love you like that. Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Nothing.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Nevis, Senior Health Educator at the Health Promotion Unit. And with me today, I have Nurse Deslyn Tyson-White, who is the Community Nurse Manager, and we're here at the Charlestown Health Center. Welcome to our program, Deslyn.
Thank you.
So today we will be talking about cervical cancer and its preventative methods. So Nurse White is going to take us through what cervical cancer is, and then she's also going to talk about the different preventative methods for cervical cancer. So Nurse White, let's start. Tell us a little bit about cervical cancer.
Okay, cervical cancer is just what it says it is. It's cancer that affects the cervix. And the cervix is what we call the mouth of the uterus. So it's the narrow area between the vagina and the uterus. So it's actually at the beginning of the uterus if you're going to go from bottom up.
Okay. And so cervical cancer, as we would know, is caused mainly by the HPV, which is a human papillomavirus. So tell us about that.
So the human papillomavirus, there are millions of human papillomavirus, Shevani, but there are only some types of that virus that causes cervical cancer. And so in a woman's lifetime, she probably would be affected by the human papillomavirus. However, sometimes the immune system of the body would cure the virus, would deal with the virus. There are other times when that does not happen, and it may lead to cervical cancer. Well, it all depends on if the HPV that they're infected with is one of the cancer-causing HPVs.
Oh, okay.
Yes.
Okay.
So it's not all cancers, it's not all of the HPVs causes cervical cancer.
Okay.
Yeah.
So what are some of the ways we can reduce our chances of developing cervical cancer?
Okay. So there are 3 ways that we usually advocate for the prevention or early detection of cervical cancer, and that is through vaccination, through Hpv screening, and through Pap Smears.
Okay. Yeah. So tell us about each one. Let's talk about the immunization first.
Okay, so the immunization, we recently started the HPV immunization here in the Federation of St. Kitts and Nevis. We started in 2019.
Okay.
Yes. And we started with grade 6 children. Why children, you may ask, and they are not sexually active?
Right.
Well, we are hoping that they are not sexually active. It's because of their immune response. Okay. So the immune response is very good. So giving the vaccines to the children, their susceptibility is better, right? And it's more effective that way. You also, when you're giving it to the children, the number of doses would also be reduced, because if you're giving it to children, we're giving it 2 doses at 6 months apart.
Okay. So you said grade 6 students. So when is the first time you give it to a child, and when is the last time? Okay, so
our schedule in Nevis is in November, and then we give it in May the following year.
Okay. And what about, so is it mandatory? Is it like restrict the other immunization?
No, it's not mandatory, no. So parents would give consent for their child to have the human papillomavirus vaccine.
And it's a situation where you guys communicate with the school?
Yes, we communicate with the school, and the school communicate with the parents. Sometimes, if it permits, we would go to the school and discuss with the parents, or the parents could also come in and discuss with us.
So since
if they have any questions or issues.
Right. So since you started in 2018, have you had any difficulties with parents understanding or giving consent because they would associate HPV and that kind of thing with sexual activity? Have you had any issues with that?
We had some persons who refused, but we would have had a very good uptake, and the refusals would have been few. Yeah.
Okay. That's positive.
Yeah.
That's positive. So for the HPV vaccine, what is the cost of it?
All other vaccines that we give in childhood, it's free.
Okay. And as you I know the answer to this, but I just wanted to highlight it for persons who are watching. So can a teenager, let's just say not a teenager, but we have a child in grade 6 who is, some of them are wiser than the others, and they heard about the vaccine and they know that they didn't get a chance to go. Can they come to the health center on their own? Like, let's just have a great time.
No, we can't. And children under the age of 18 actually are not supposed to be accessing the health services without the consent of a parent. So,
Good. I wanted that highlighted. Okay. So what about the other? So we spoke about immunization, which is the HPV vaccine. Now I had a question for persons who are no longer in grade 6 like myself. Can we access the HPV vaccine?
No, we don't offer it to persons outside of grade 6 currently.
What's the reason for that?
Because the target population, it's now being introduced, we have a target population, and so that's the target population that we are concentrating on right now,
and that's what
which is grade 6 for now.
Right. Okay. So then let's talk about preventative methods for persons outside of grade 6 who are older. How do we now prevent ourselves from HPV?
Okay. So as we told you that HPV is considered a sexually transmitted disease,
right.
And so we advocate that persons use condoms if they're going to be having sex, anal, vaginal, oral, because it could be transmitted through any route, right? Just like the other sexually transmitted infection. So we advocate for using protection. However, even if you use condom, there's still that possibility that you might get. You might be able to contract the HPV because of the HPV itself getting in contact with the skin outside of condom use. Okay. There's also the Hpv screening. If you're screening for HPV and you're HPV positive, that would give your healthcare professionals would be able to advise you accordingly depending on the type of the human papillomavirus that might have been present. And also they would be able to offer you more information and suggestions as what your future holds and how you to go about screenings in the future. You might have to be checked more often. Pap smears, right? So you know that you were positive for HPV infection. I remember I said before that some infections go on their own because your immune system, but some other infections linger. Not because you have HPV means that you would get cervical cancer, right? But there's that possibility that later on you could develop cervical cancer, right? So now how would we be checking to make sure that you don't develop cervical cancer or to check for any changes? So there's where the Pap smear comes in.
Okay.
The weekly Pap smear schedule for the various health centers on the island are as follows. Charlestown Health Center on Fridays, Brown Hill Health Center on Thursdays, Gingerland Health Center on Thursdays, Butler's Health Center on Thursdays, Combermere Health Center on Tuesdays, and the Cotton Ground Health Center on Mondays.
Right? And so we encourage women who are sexually active to do their regular Pap smears. Sometimes persons would come and say, when you offer them a Pap Smear, or you encourage them to have a Pap Smear, they would tell you that they're not sexually active. That's, for 5 years now I haven't had sex, but you would have had sex, right? So it means that you might have been at risk. So we still encourage persons. So some persons feel like if they are not having sex, even if they had sex before, they are not supposed to be doing the Pap smears. But persons are supposed to still be doing the Pap smears once you would have been exposed to sex.
You see, I was one of the person that used to think that, because I guess when I first heard about it, they would tell you if you're having sex, make sure to have it at least once a year.
Yeah.
So in your head, it's like,
if you're not having sex for 2 years, you don't need to have it. No. But once you would have been exposed to sex, you need to be doing your Pap smears. Because the HPV virus, sometimes it lays dormant for a while. Yes. So sometimes persons might do a Pap smear. Because sometimes when you do a Pap smear, it may show up. It's not going to tell you which type. So you could do a Pap smear and you might show that you have a HPV infection. But the HPV screening itself would tell you you have this type, or you have, that type, because they are specifically looking for HPV. With the Pap smear now, you're looking for changes in the cells of the vagina and cervix. Right?
So walk us through what a Pap smear is like, or what happens during a Pap smear examination.
So during a Pap smear examination, as we said, the Pap smear is that examination or that procedure that we do to remove cells from the cervix. And we spoke about the cervix earlier, which is the mouth of the womb, right? And so what we usually do, we use a vaginal speculum, and we would insert the speculum into the vagina. Once the speculum is inserted into the vagina, then we would locate the cervix. We locate the cervix, and we usually take 3 swabs. So we do a vaginal swab, a swab from outside of the cervix, and then we do a swab from inside of the cervix, and those are put onto a slide and sent to the lab for examination.
How long does that procedure take? Not the examination, the actual Pap smear procedure.
The Pap smear procedure, it's not long. It's not a long procedure, but it could be a bit longer. So it usually takes maybe about 5 minutes during doing everything. But we could be shorter as well, right? But some persons, depending on the position of the cervix, it might be more difficult to locate the cervix, and so you have to do different things.
Is it uncomfortable for the lady?
Yeah, it is uncomfortable. It is an uncomfortable procedure, but it shouldn't be painful. And so what happens is that sometimes persons, especially if you're having it done for the first time, because you hear what everybody says about it, and so you are frightened. So some persons usually come and they are tense, and if you're tense, of course, it would be, it will become more difficult, and it might be even painful. And so we usually encourage persons to just relax, and we try to talk them through, and talk to them while we are doing the procedures, at least to alleviate any fears and, make them more comfortable.
And then how long does it take for them to get the results back?
The results are usually back within like 2 to 3 weeks.
Okay.
Yeah.
That's not bad. And where can you access Pap smear screening on island?
So on island, all health centers, all 6 health centers on the island offer Pap smears on different days. And you could go to your doctor's office as well. Some doctors, I'm not sure if all doctors, but some doctors do offer Pap smears. So persons could ask their health professionals other than the nurses at the health centers if they do Pap smears, if they offer Pap smears.
Okay, and what? Go ahead.
But the difference is the Pap smears at the health centers are free of cost.
That's true. And then you go to the doctor, you have to pay.
Yes.
Right, that's true. And what is there? So before we spoke about the Pap smear, we spoke about HPV screening. What does HPV screening entail?
Is taking swabs, just like the Pap smear, taking swabs from the the cervix and the vagina. And so it's basically done like a pap smear, like as if you're doing a pap smear, but the preparation is different. So instead of putting it onto slides, you would have to put it in a different prepared medium. Yeah.
So it's not like a blood. You can't take a blood test.
It's not a blood test. It's a swab.
I always thought it was a blood test.
No, it's a swab.
Right. And so I want you, cause just for parents who might be a little uncomfortable because who are watching, the HPV vaccine is offered to children in grade 6, but this does not imply that we're offering it to children who are sexually active. It doesn't.
No.
What
What's happened? Yeah, because initially when the vaccine first came on the market, persons were labeling it as the sex vaccine and stuff like that. And so parents would have initially been against it. You had churches, everybody coming against it because you are saying cervical cancer. Well, if you're talking about cervical cancer, it means sex, right? And so, but no, it doesn't mean that you are having sex. And we actually try to give it to persons before sexual activities, not because, well, I remember I spoke of the immune response, right? But also giving it to somebody. If I take it, maybe I myself have already been exposed, and so the vaccine wouldn't help me because I would have already had the HPV vaccine, the HPV virus, right?
Right.
So parents, don't think that we are saying that your children are having sex. We are just preparing them for later on when they decide to have sex. No, that they would have been protected already. Their immune system would have been already protected. And they would be able to combat the virus if they so ever come into contact with it.
Right. So when a child or a female gets it in grade 6, how long does it last?
We give both males and females.
Oh, yeah?
Because men do transmit the HPV vaccine and the men do transmit the HPV virus. And the HPV virus also causes penile cancer as well. It usually causes penile cancer. You could get cancer of the anus from HPV and oral cancer as well. Yes. So we give it to both.
Okay.
Yes.
Oh, that was good to know. I thought it was just the female.
No. So it's given to both. So it's not HPV is not a virus that discriminates.
Right.
Yeah.
Like a lot of viruses. So when you give it to them in grade 6, is it for their lifetime? They're protected for
yes,
lifetime?
the 2 doses, yes.
Nice. And what if they miss one dose? Like if they miss the last dose?
If they miss one dose, if they miss the last dose, depending on the period, we might have to give them 2 doses.
Okay.
Depending on the period during the time that they had the first dose and the second dose.
Okay. And older persons who would develop HPV from whether sexual intercourse or whatever, you were screened and they found you positive, do you have it for the rest of your life?
The HPV?
Yeah.
Remember I told you that sometimes your body would clear it on its own. Other times it may linger around. So if you get HPV virus, I can't say to you, well, Chevani, you have HPV virus for life. Okay. Because there are some times when it clears. There are other times when it lingers around and you have it throughout your lifetime, but it doesn't affect you. There are times when you have it and it affects you.
Got it. Okay. So what is community nursing doing for Cancer Awareness Month? Okay.
So we are doing the usual. We usually do what we call a Pap Smear Outreach on the last Saturday of January. And so like the years that we have done it, we are doing it again this year. Okay. And why we chose a Saturday is because sometimes persons would give the excuse, or some persons aren't able to get off from work because of the hours that they work. They work during the same time when we are working. Right. And so some persons don't get that time to do their Pap smears. So we don't want anybody to have an excuse not to do their Pap smear. So we are making ourselves available. Awesome. We are taking off our mornings from home and doing our different activities, and we are spending it in the health centers. So all health centers would be opened to do Pap smears on the 30th of January from 8 to 11 a.m.
Wow.
Yes.
And tell them who you're encouraging.
Yes. And so we are encouraging persons who would have been exposed to sexual activities. So please don't tell me, well, I haven't had sex for 10 years. I haven't had sex for 5 years. I'm not having sex anymore. I only had sex once, right? Once you would have been exposed to sexual activity, we want you to come in and have your Pap smear done, right? Early detection saves life.
Right.
Okay?
Right. Thank you, nurse.
You're welcome.
Is there anything else you'd like to tell our audience?
I'm just encouraging persons, if you would have missed our outreach, because some persons really want to come to the outreach and they are not able to. All health centers on Nevis does Pap smears every week. So what you could do is call your health center in your area. We usually encourage persons to go in their area and have their Pap smears done or access the health centers in their area. However, if you would still be accommodated at other health centers to do your Pap smear. So if you miss your clinic date for your area, you could also contact another clinic during that week to see if what day they would be doing it and if you could be accommodated on that day, right? Because some persons, maybe Charleston, we usually have it on a Friday, but maybe our clients might be working on the Fridays. They might be working on the Saturday as well. But you could go to another health center when you're off during that week to have it done. We just need persons to do their Pap smears because we know cervical cancer is, cervical cancer doesn't happen overnight. And so that is why we encourage persons to do their regular Pap smear screening, because you do your regular Pap smear screening, it means that changes in the cervix, changes in the cells could be detected early and treatment could be given that could prevent these changes from leading to cervical cancer.
Oh, yeah, that is
okay, yes. And if when we do the test, there is the presence of cervical cancer, then treatment could be started as early as possible as well.
Could save a life.
And that life can be saved.
Right. What about persons? There any before you come to get your Pap smear, should you make sure that you're not on your period?
Yeah. So we usually encourage persons when they're doing their Pap smears. We don't want you to do your Pap smears around the time when your period is about to come, or during your period, or soon after your period, because when you're with your period, when you're menstruating, your hormonal levels changes, and so if you do a Pap smear during that time, it could give a false reading, and then give you a false reading, and then you are worrying up yourself and everything. But that change would have just been because you would have been menstruating, and that your hormonal levels wouldn't have been what it is usually is. It's only because of the presence of your menses. Okay. Right? We usually also encourage persons not to have sex for at least 24 to 72 hours prior to, because of that, when you're having sex, because of the motion during sex, cells are eroded, right? As well as sometimes sperm may be inside of the vagina, and so when we are doing the swabs, you might have a mixture of, and then you end up also, and then the sperm would probably change the pH as well, and so you might get an incorrect reading. Yes, but what we don't advocate for persons to do is put their finger, their rag, or anything inside of their vagina to say that they're cleaning out everything, right? The vagina cleans itself, and if we continue inserting our fingers and our rags or whatever we insert inside of the vagina to say we are removing whatever fluid is inside, whatever is inside, we are actually exposing ourselves to infection and for bacterial growth, because we are actually altering the pH of the vagina. The vagina have its own pH, and so we are not supposed to be removing the fluids from inside the vagina. Right?
Yes. Yes. And what about persons who they remember they have to take they want to do the Pap Smear on Saturday, so they have sex on Friday morning and they douche. What about
And
that?
we don't advocate douching. We don't advocate douching as well, because when you douche, that's what you're doing. You're removing the bacteria that is inside the vagina that is actually supposed to be cleaning the vagina and keeping the vagina at a certain pH.
Right.
So we don't advocate douching.
Okay.
So we usually say the only thing that is supposed to be connected with the vagina or inserted into the vagina would be the penis or the speculum for examination. Right?
That's fair. That's fair enough. Okay, thank you, Nurse Tyson White.
You're welcome.
Thank you so much for the information. It was very informative. I myself learned a lot, and I'm pretty sure our audience learned a lot as well. So, for this week's edition of Health Matters, we spoke with Nurse Desiree Tyson White, who is the community nurse manager, and we are here at the Charlestown Health Center today. And we spoke about HPV. We spoke about HPV, which would be the human papillomavirus. We spoke about cervical cancer and what are preventative methods for developing cervical cancer, and that includes the vaccination, which is the HPV vaccine, that's immunization, and we spoke about the Pap Smear, and we spoke about Hpv screening, right? And so we just want to encourage...
And safe sex.
And safe sex. Always safe sex. You know I'm an advocate for that. Right? So we'd like to encourage everyone to, especially if you've ever had sex in your life, females who've ever had sex in your life, that you should get screened for HPV, get screened for cervical cancer. And we're having a Pap Smear Outreach or Pap Smear drive on Saturday, the 30th of January from 8 a.m. to 11 a.m. at all health centers. And if you are not available to get your screening done on that Saturday, you can check your health center. All health centers on the island operate at various times in the week, various days in the week, right? And so please remember, it's January Cervical Cancer Awareness Month, and the color for cervical cancer is turquoise and white, I think, or teal and white. So you could wear something like that if you want on the day. And the theme for this year is get informed, get screened, get vaccinated. This has been this week's edition of Health Matters. I am your host, Shavani Nisbet, Senior Health Educator at the Health Promotion Unit. And I had my guest here, which is Miss Nurse Desiree Tyson White, who is the nursing manager, community nursing manager. So thank you for viewing, and do enjoy the rest of your evening. The fruit of the week is pineapple. Pineapple is a rich source of vitamin C, and also it is tasty and serves as for fiber and various other nutrients for the body. So have yourself some pineapple this week.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself, nothing